What is mammography?
Mammography is an X-ray of the breast with the purpose of trying to detect tumors that may be lurking in there that we need to find and remove.
Is the X-ray mammogram accurate in general?
In general, yes. I think we can't expect perfection out of any technology, but in general, we have very good results with mammography in detecting tumors earlier than you can feel them.
What does it look like when you've got a breast cancer and you're doing a mammogram? What does it look like when you're viewing it? Is it something in 3D or is it something on an X-ray?
Both exist. A traditional mammogram is two-dimensional, taken from two views, but the latest trend in the last few years is something called a tomogram, which is a three-dimensional mammography, and it has become more sensitive in detecting tumors. And you ask what it looks like. The typical description is what's called, this is medical terminology, a spiculated density.
So
that
what's
means
spiculated density?
I'm glad you asked. It means a little solid mass within the breast, and spiculations sounds like spikes, right?
Yeah.
Breast cancers have little spikes sticking off of them.
Can you see them?
You can on a mammogram, yes.
Do you have to have the tomography or the 3D, or can you just do it you can see that on a regular?
You can often see them on a regular mammogram, but tomogram does help, and often you can see them smaller or earlier with three-dimensional tomography than you would on a two-dimensional mammogram.
So if the radiologist says there's a suspicious area, we need to get further testing, what is more sophisticated than just the mammogram?
Well, in terms of imaging, the next thing they would do is go to an ultrasound, which is a painless test which uses sound waves to measure changes in density throughout the breast.
What can they find on a super duper ultrasound?
Well, they can find little densities within the breast.
Spicules?
Often, yes, but irregular borders and density and shadowing, because sound waves pass through the breast and create shadowing behind it. And this is a clue that really that's something that we need to biopsy, because that's where the real diagnosis comes in.
So how do you biopsy a breast? What do you do? Walk me through that.
Most of them are done with ultrasound guidance. And
what does that mean? Ultrasound guidance?
Meaning the target, the suspicious spot in the breast that we want to biopsy is targeted in real time with the ultrasound. The skin and the breast tissue are injected with numbing medicine to try to minimize pain. It hurts a little bit, but not a lot. And then a needle is passed through the skin into that little suspicious mass while we're looking at it with ultrasound, and it clips out just a tiny bit of the fragment of that suspicious mass and takes it out so that a pathologist can look at it under the microscope, and that's the type of doctor that truly renders the diagnosis of a cancer.